While hyperbaric oxygen is not a cure for chronic fatigue or fibromyalgia, there is new clinical research that's come out showing that hyperbaric actually does support people dealing with these conditions. And in this video, we're going to dive into some of that literature to better explain exactly how hyperbaric is helping patients with these conditions. I'm Dr. Jason Saunders, and I've been working in the hyperbaric industry for over 20 years, treating patients, doing research, teaching, educating, and certifying doctors and technicians in hyperbarics and safety and compliance inside this industry. And over these 20 years, I've treated hundreds and hundreds of patients with chronic illnesses, including conditions like fibromyalgia and chronic fatigue. And while we know that hyperbaric oxygen is not a cure for these conditions, it is absolutely appropriate to use, and I find a foundational component of these patients' recovery and bringing them back to a healthier and more stable quality of life. And while some patients might be diagnosed with one of these conditions over the other, there is still quite a bit of overlapping within the symptomatology of both of these conditions. They include autonomic nervous system imbalance. They include increased sensitivity to pain signals. They both also commonly include chronic inflammation, fatigue, and of course, frustration due to what appears to be lack of options from a treatment standpoint. Many patients with these diagnoses are looking for additional therapies, out-of-the-box treatment plans to get relief and to stabilize and improve their quality of life. Whether recommended by a friend or a family member or by doing research inside of different online support groups for people with similar conditions, hyperbaric oxygen therapy often becomes a recommended modality for people suffering from these conditions. So let's talk about why hyperbaric comes up so frequently when talking about people dealing with such complex and chronic conditions. We know that these patients are suffering from chronic pain, which is typically stemming from a chronic level of increased inflammation. We also know that hyperbaric decreases inflammation systemically. It turns down the inflammatory cytokine cascade, and it turns up our body's own anti-inflammatory pathways. As a result, we get a balancing of the immune system. We know that many of these patients are suffering from central sensitization and other neurological consequences of this chronic inflammatory pathway. We know that hyperbaric reduces the pain of central sensitization. We know that hyperbaric improves neuron synapse connection and stimulates neuroplasticity, more and healthier synapse connections for improved signaling from the brain to the body and from the body back to the brain. We know that these patients have fatigue, they are exhausted. And we know that hyperbaric stimulates an increase in cellular energy production, driving more oxygen into the mitochondria and having the mitochondria produce more ATP, more cellular energy, more efficiently, more quickly, and in much greater quantities than what can be done without hyperbaric oxygen. We know that these patients are suffering from autonomic nervous system dysregulation, an imbalance in the nervous system. And we know that hyperbaric actually helps to balance the neurotransmitters, improving the balance between the sympathetic and parasympathetic systems of the autonomic nervous system. Many of these patients are sympathetic dominant, meaning the stress side of their nervous system is hyperactive, the fight or flight side, whereas the parasympathetic, the rest, the digest, and the recovery side is underactive. And we see a balancing of the autonomic nervous system in patients undergoing consistent hyperbaric treatment. These newer studies that have come out in the past few years have really provided tremendous hope for these patients who typically feel like they've exhausted all of their options. There was a meta-analysis done in 2023, which essentially is looking at a number of individual research studies on fibromyalgia and chronic fatigue and collecting all the data from the different research projects and compiling it into a single paper. Inside this meta-analysis, it showed that the overwhelming majority of patients had decreased point tenderness from a pain standpoint, and in particular with the diagnosis of fibromyalgia. Most of the patients inside all of these studies showed improved level of energy and a subjective improvement in their overall quality of life. Interestingly, it also showed one of these studies was done at lower pressure, and the lower pressure had similar results as the higher pressure studies. The lower pressure being at around 1.4 and the higher pressure studies being closer to 2.0 or greater. This also tends to indicate that maybe the lower pressure is the minimum effective dose required for getting some of these benefits. Sometimes patients with chronic illnesses don't tolerate the higher pressures as well. And so starting at lower pressures might just be more appropriate in many of these cases, and only increasing pressure if they're not responding to the lower pressures that you start with. We will get right back to that video, but real quick, there are a number of rules and regulations and best practices that you need to know in order to be safe and compliant and run your practice accordingly. If you're not sure that you've got all your bases covered, we've created a free checklist for you that maps out everything that you need to become compliant inside the hyperbaric industry. You can grab that checklist for free by clicking the link in the description below. And now back to our video. Protocols for chronic conditions, especially something like chronic fatigue or fibromyalgia, is typically no less than 40 hours over about 8 to 10 weeks, meaning 4 to 6 hours a week for 8 to 10 weeks to get to a 40-hour minimum. Those could be done in 60-minute or 90-minute increments, but it takes that many sessions to really make a marked change in the physiology of somebody dealing with such a complex chronic illness. I'll leave a link to that meta-analysis in the description below in case any of you want to take a look. Unfortunately, so many patients with these diagnoses, by the time they find hyperbaric oxygen, they are at their wit's end. This is one of the last attempts, perhaps it is the last attempt, at one of these patients finding relief from this chronic illness. And luckily, for so many of these patients, it's absolutely part of the solution. If you or someone you love has been diagnosed with one of these conditions and you're suffering and you're looking for answers and you've heard that hyperbaric might be part of that solution, from a clinical standpoint, I can tell you we've seen so many people benefit from hyperbaric oxygen in these cases. Thank you so much for taking the time to watch this video. I hope you found it informative. I hope you found it helpful. If you know somebody who might benefit from this information, please feel free to share it. That's why we put it out there. Thanks for your attention, and we'll see you on the next video.